Tamiflu is losing its punch. Doctors in the northern hemisphere report flu viruses are becoming more resistant to what was once the best flu treatment available. At the U.S. Centers for Disease Control, Dr. Alicia Fry analyzes flu viruses.
This year, the prevalence of resistance is very high.
In the past few years, researchers have noticed a change in how one strain of the virus has become resistant to oseltamivir, the generic name for Tamiflu.
Last year, about 12% of the influenza A H1N1 viruses were resistant to oseltamivir, and this season it looks like approximately 98% or almost 100% of those viruses are resistant to oseltamivir.
Just 2 years ago, only 1% of the samples she examined were resistant to the drug. It leaves health officials and doctors concerned about how to treat a possible pandemic and how to care for individual patients. Dr. Greg Poland of the Mayo Clinic.
There'll be more hospitalizations, and yes, there could be more deaths.
If there is good news, it's that the resistant strain of influenza is no more deadly than normal, unlike the highly lethal bird flu. But there is only one well-tested alternative to Tamiflu, an antiviral drug called Relenza. It's given through a dry powder inhaler that many patients find difficult to use. Others cannot use it at all.
People with chronic respiratory conditions such as asthma, pregnant women, and children under the age of 7.
Oseltamivir still works for other strains of influenza, but the Centers for Disease Control is urging doctors to use an older flu-fighting agent if they do not know which strain a patient has. Dr. Fry says prevention may be more important now than ever before.
The best defense against influenza is vaccination.
But flu vaccines don't offer total protection. So doctors also recommend frequent hand washing and staying away from those who have the flu. Meanwhile, infectious disease experts are urging the global medical community to find new drugs to combat the flu. The report from the Centers for Disease Control is in the Journal of the American Medical Association. Carol Pearson, VOA News.